Hello, my name is Lex Lutzenheiser, and I am the Outreach and Education Specialist for Mental Health and Substance Use Connections. Connections is a program of the Health District of Northern Larimer County, which is a special tax district, much like a school, water, or fire district. We were created in 1960 by voters to meet the health needs of the Northern Larimer County community. Connections is made up of two smaller programs, Adult Services and CAYAC, which stands for Child, Adolescent, and Young Adult Connections. In this video, you'll have the opportunity to hear from some of my colleagues about all of the services that we offer.
Hi, I'm Chantel McCarthy, and I'm a behavioral health specialist with the CAYAC program.
Hi, I'm Heather Truschel, and I'm a mental health specialist supervisor.
When parents first call into CAYAC, we kind of first assess what they're looking for. Sometimes you're looking for therapy referrals, psychiatric evaluations, or psychological testing. After speaking further with the parent to kind of figure out what their needs are, we may start with a basic needs assessment, which will look at client demographics. If they're looking for therapy, we'll talk about, are they looking for a specific type of therapist, specific type of therapy, and do they want to pay out of pocket or use their insurance. If they're looking for further services like a psychiatric evaluation and do you want to come into CAYAC, we'll do a more thorough needs assessment looking at any past medical diagnosis, mental health issues, if they've ever engaged with psychiatric services, psychological testing, or have been in therapy before. This just helps our providers here at CAYAC to have a better idea of what worked, what didn't, and kind of just what next steps to move forward. If they're looking for further services, maybe like brief therapy, sometimes we can provide that in-house at CAYAC.
And so if there's a gap or barrier to getting connected to a long-term therapist, a mental health specialist can provide up to 10 sessions. If the client has Medicaid or CHP+, there's no fee for service. However, if they have no insurance or private insurance, then it can cost anywhere from $0 to $100 a session, depending on the family size and family income. When we do a needs assessment with the family, we'll talk about if brief therapy is appropriate or needed, as our goal is always to help people get connected to the most effective treatment.
Hi, I'm Usha Udupa. I'm a child and adolescent psychiatrist working at CAYAC. Typically the process, what we start with when a parent or a family calls is they will call, they'll talk to our front desk staff, who will then quickly refer them to our therapist. A therapist typically will do a full needs assessment, and if there are any behavior concerns, mood concerns that they feel might need a psychiatric evaluation, then they get sent to me. I do a full psychiatric evaluation, and depending on what the kids are presenting with, I might be talking about starting them on medications if appropriate. Very frequently I'm also recommending therapy. And if I'm concerned about any cognitive issues or autism, I then make a referral to our psychologist at CAYAC to do a full psychological testing. Typically, once I start seeing a child for an intake, I will see them for about 4 to 6 visits, depending on if their medications need to be adjusted. If these kids' response to medications are pretty straightforward, I try as much as I can to refer them back to the pediatricians. If these kids' symptoms are more complex, we then encourage the families to reach out to providers in the community, get on a wait list, and we'll continue to help bridge the gap until they are established with a provider in the community.
Hi, I'm Mary Beth Regali Euler, and I'm the lead psychologist on the CAYAC team. My role as the psychologist is to provide our team with an additional consultation for any family who comes in when we're thinking about what would be the best treatment for that individual. We all talk as a team, and I provide my psychological expertise in that treatment team meeting. Another component of what I do at CAYAC is I provide direct testing for clients. Sometimes psychological testing can be really important for better understanding of a client's presenting concerns. If a family doesn't have access to community testing options, they can come in-house, and I provide testing for autism, ADHD, cognitive abilities, mood, personality concerns, and I have a few other clinicians who do testing along with me. One of the things I love most about being on the CAYAC team is being able to work with the kids and the teens. There's nothing like being with somebody who is full of life and full of energy, and sometimes we have to take dance breaks when we're doing testing, and I just have a lot of joy every day at work.
Hello, my name is Lindsay, and I'm a care coordinator for the Child, Adolescent, Young Adult Connections group. In my role, I help families get connected to community resources. That's basically what care coordination is. Some details about care coordination are that aside from helping families get connected to long-term services, care coordinators also help communicate back to the referring people. So that could be the doctor of the individual or the school who's helping the individual. And other factors of care coordination involve helping the family understand their rights and help them advocate for their family member. So for me, I value my role as a care coordinator because I really enjoy helping families get connected to long-term services and helping them know that there is hope for whatever it is they're dealing with, that there's someone out there who can help.
My name is Anna Pacini. I'm one of the bilingual care coordinators on the CAYAC team. One of the best things I love about my job is when we receive a referral, if it's from a community care provider, if it's from a school, or if it's a parent that the Spanish is their primary language and they call us, that we're able to meet them where they are as far as understanding our services. And what that means is that I can gather information, I can translate for the mental health therapist when we're doing an intake. If it's determined that coming in for psychiatry is best for that child, we ensure that all the forms that they have are in Spanish. We ensure that the appointment was made and explained to them in their language. And we also translate during the psychiatric appointment. Follow-up to that also could be brief therapy, could be testing. During that time, I love that I get to sit with the families while the child is either in brief or is being tested so that I can help them understand what our community has and what is best for them. And many times I will sit with them and we will call community providers. We will express what the needs are and take away the language part that might have been the barrier in the beginning to what a parent wants, and that's what's best for their child. And we want to be part of that journey in CAYAC and helping not just that child, because we know it's not just about the child, it's about the whole family, and by helping the family, we have better outcomes.
Now that you've had the opportunity to hear from some of my colleagues about CAYAC's direct services, I want to let you know about some educational opportunities that we offer the community. First, we offer suicide prevention training called QPR, or Question, Persuade, and Refer. Second, we offer different trainings on mental health based on topics that you request. So if you or another group out in the community is ever interested in having us come speak, please don't hesitate to reach out. Third, we offer mental health speaker series throughout the year based on different topics that are trending in our community. If you ever have a question about educational services or any of the services that we offer, please reach out at 970-221-3308. Thanks so much for watching our video.